Welcome back to Healthy Living. Yes, you will recognize our imaging navigator, Miss Angie. It's great to see you again. I feel like it's Old Home Week. We talked to Dr. Ringer, we're talking to you today, and I especially want to talk about what an imaging navigator does, because I think you are really the linchpin to people's positive experiences when they're here at the hospital.
Well, thank you for having me, Debbie. It's always a pleasure to talk to you. So as far as my imaging navigator position, the main thing that I do is follow patients through their mammography. So if they have an abnormal mammogram, then I'll call them and get them scheduled, but explain why they're coming back. That way the patient has some explanation of why they're coming back, just to where it'll ease their mind.
Okay.
Because, you know, women get very anxious if they have to come back for anything that's abnormal.
Exactly.
And then also, you know, if they do come back for the abnormal imaging and then the radiologist recommends a biopsy, he will talk to them about it, but then I'll bring them in my office, consult them, to where I can explain the procedures, explain everything to them, ease their mind as much as possible. That way, you know, they have some type of direction before they leave.
So what I hear you say is you basically can handhold me through what can be a pretty scary and intimidating process from the get-go.
Exactly.
So when I'm scheduling, well, first of all, would I just be going in for my regular mammogram? Mm-hmm. Start me and take me through the process.
So you come in for your screening mammogram.
Okay.
We call all of our patients with their results.
Okay.
Either we will call them in the morning or the next day, depending on
Everybody.
when they have it. Everybody.
Okay.
And actually, I do that. Mm-hmm. And then if they have an abnormal mammogram at that time, that's when I call, schedule, explain it to the patients, and then I'll call their physicians for the referrals.
Got it.
To where they don't have to do anything but just come back for their abnormal mammogram.
And you know, this is October. In October, you do something special with mammograms.
We do. So we offer late appointments every Monday. We call it Mammo Monday.
I like it, Mammo Monday, for we active people.
Exactly.
Mm-hmm.
So it is for the active women that maybe can't come in a routine, you know, normal time. And we offer it from 5 until 7. We have 2 more Mondays. So if anybody would like to do that, they can come in or call our scheduling team and get that scheduled.
Oh, that is huge. I know sometimes it's just tough to break away during the day.
It is. And we've gotten a really great response from it, from women that, you know, are active and busy and can't come at the normal business hours.
One of the things that you and I were talking about as we were kind of chatting before was the abbreviated MR imaging now that's available. Can you
Correct.
share? Yes.
So,
what's that about?
So we are the only facility that offers additional imaging information for the patient. So by law, you have to send a layman's letter to the patient with their results. Even though we're calling them, we still have to send a letter.
Okay.
But we include another letter, and that letter will give the patient their lifetime risk, and it also gives them the information of what type of breast tissue they have as far as dense breast. So if a woman has dense breast, it can increase their risk of developing something maybe we can't see. So if their lifetime...
With the traditional mammogram.
That's correct.
Okay.
Even with the 3D. 3D is across the board what we want to do for any woman that has dense breast.
Got it.
But abbreviated MRI is just a little extra something we can do. So if a woman has a lifetime risk between 11 to 20%, then they can have an abbreviated MRI. That is a really reduced price for women that may want to do that. And it's a shorter MRI, but it gives us information to go with that mammogram to make sure there's not anything hiding in that tissue that maybe we can't see. Mm-hmm. Now, if a woman is 20% or higher, then we recommend them go to a lifetime risk clinic to where someone can follow them closer. And we recommend a regular MRI and 6 months later a mammogram.
So just practically here at the breast center, that patient would then transfer from you being their navigator to Dr. Ringer and that nurse navigator.
That is correct. So what they do is they follow everything as well, and they will do the lifetime risks just like we do. If it's a Dr. Ringer patient, we let them handle the lifetime risk, and we let them handle everything after we determine that they're already 20% or higher.
So that's, again, it's kind of like, do I hear what you're saying? It's basically no woman is left, or no person is really left without someone who is taking them through this process here.
Right, exactly. So they have direction every which way. Either it is from the letter that they receive from us to where they can talk to their provider about that, or is it a higher risk to where their provider will refer them to like Dr. Ringer.
I don't know why, but having a navigator, just having someone that I think is a point person that I can talk to and not really bother a physician, but if I'm scared or if I'm not sure, if I want, to ask dumb questions or not so dumb questions, that's really what you're there for.
Exactly.
And then again, if something does show up and I have to go to the next stage, you will kind of transition me to that person too. Do you all work collaboratively?
Oh, we do. Actually, my office is in Dr. Ringer's office, and then our radiologist sits, in his office right beside Dr. Ringer. So we all have a great relationship. We are very excited about our breast health center just because we provide so much more to our patients than other just regular mammography departments.
I think patients become people.
Oh, they do.
That's something that you told me, it's pretty amazing.
You have to really build a relationship with a patient, and the main thing is to encourage them to be able to get them through whatever is going on, regardless of what it is, either a diagnosis of cancer or just abnormal imaging.
So once I am in the system, if you will, and I recognize that I have a bit of a higher risk, and you are my nurse navigator, do then every year I go ahead and schedule my appointment? Do you call and remind? How does all that work? It's a moving forward thing, really.
So as far as mammography, you do get a reminder letter.
Got it, okay.
Every 30 days before you're due for your mammogram, because Medicare still, wants you to go one day after your yearly mammogram.
Okay.
So it's a year and 1 day before they'll pay for it. But you do still need to have a mammogram every single year, from 40 until on.
100.
Yes, 100. I don't care how old you are, make sure you get that
your
mammogram every year, because it's so important. Because if calcifications develop in your breast, that is what we see on mammography, and that is the earliest stage of a breast cancer. But if you don't come for your mammogram and we don't determine you have calcifications, then it could just blow up and become a really bad mass.
It's funny, we were talking to Dr. Ringer, and we were talking about how with COVID, how fast time goes, and you sort of forget that year, and before you know it, you've skipped.
Yeah, we've had a few patients that have skipped, but I think now, even though COVID is going on, everybody is starting to kind of get back into their routine of health, making sure they're getting their yearly appointments with everything.
Talk to me about someone who gets a mammogram. Typically, if it's healthy, is it read within a week, a day? How does all that work?
So a mammogram's read in a day.
Okay.
Unless our radiologist is crazy busy. The only reason it would not be read within that day that they're having it done is because we're waiting on old films.
Got it.
Sometimes we have to wait on old films, and our mail system,
Yes.
so it can take up to 2 weeks sometimes for us to get those films. So those patients get a letter in the mail with their results, but their doctor also gets the report.
Before I do an abbreviated MR, am I going to be going through an ultrasound?
Not necessarily.
Okay.
No. So, there used to be the recommendations is if you have dense breasts that they would recommend an ultrasound with your mammogram. That's not the case anymore.
Got it.
Mostly MRI is more sensitive to the breast tissue, and that's what we recommend. We will still accommodate women that are used to getting that yearly ultrasound, but that's not our recommendation that we follow. But we will accommodate women that just wants that assurance of knowing that's what they used to do.
As always, talking to you, I feel reassured. I hope you all feel reassured here. Also, we want to thank you for joining us for Healthy Living.
Thank you so much.
Have a safe and wonderful week.